What causes recurrent UTIs even after antibiotics? Imagine battling an infection only to find it keeps coming back. That's what many people with urinary tract infections experience, even after treatment. So, what's really going on? Let's explore the facts. Recurrent urinary tract infections are quite common, especially among women. About a quarter of women will have a second infection within 6 months of the first. Sometimes, infections happen again every few months. Understanding why this happens is key to better treatment and long-term bladder health. One surprising fact is that antibiotics, while they kill bacteria causing the infection, can sometimes make the problem worse. When antibiotics clear bacteria from the bladder, they often don't eliminate bacteria hiding in the intestines. These bacteria can multiply and travel back to the bladder, causing another infection. This creates a cycle where antibiotics may unintentionally set the stage for more UTIs. Repeated antibiotic use can also harm the good bacteria in the gut, reducing microbial diversity. This disruption can weaken the immune system and make it easier for bacteria to cause infections again. Another factor is that bacteria like Escherichia coli, which causes most UTIs, can hide inside bladder cells. Once inside, they are protected from antibiotics and can reemerge later. Devices like catheters can also contribute by providing surfaces for bacteria to stick to and from biofilms. These biofilms act like protective shields, making bacteria resistant to antibiotics and leading to recurring infections. Incomplete bladder emptying is another common cause. When the bladder isn't fully emptied, residual urine remains, creating a perfect environment for bacteria to grow. This pooling of urine can lead to repeated infections. Additionally, the connection between the gut and bladder, called the gut-bladder axis, plays a role. Changes in gut bacteria can influence immune responses, making some people more prone to recurring UTIs. Research has also uncovered that nerve cells in the bladder can grow excessively after infections. This nerve overgrowth can cause persistent pain and urinary frequency even after bacteria are gone. During infections, bladder lining cells shed, and nerve tissue nearby can be damaged. The body responds by rapidly growing new nerve cells, which heightens bladder sensitivity and symptoms. This means that even if antibiotics clear the infection, symptoms may persist because of nerve changes. Structural issues like kidney stones, tumors, or nerve problems affecting bladder function can increase the risk of recurrent UTIs. Certain behaviors also matter. Delaying urination, dehydration, wiping incorrectly, or sexual activity can introduce bacteria into the urinary tract. Menopause and vaginal health are important too because declining estrogen levels can disrupt protective bacteria in the vagina, making infections more likely. Sometimes, treatment failure is due to not completing the full course of antibiotics or using them for too short a time. Not following the prescribed regimen allows some bacteria to survive and cause future infections. Underlying conditions like stones or abscesses may also harbor bacteria that antibiotics alone can't fully eliminate. Understanding these factors highlights the importance of a comprehensive approach to managing recurrent UTIs. Simply taking more antibiotics isn't always the answer. Healthcare providers now recognize the need to look at microbiome health, bladder function, structural issues, and lifestyle habits. Addressing these root causes can help prevent future infections and protect long-term bladder health. If you experience recurrent UTIs, it's essential to work closely with your healthcare provider to identify specific contributing factors and develop a personalized plan. Remember, each person's situation is unique, and effective management often involves multiple strategies tailored to individual needs.